Hello everyone. Today I'm here to talk about bladder cancer. Bladder cancer happens whenever normal cells in the bladder change into abnormal cells and grow out of control. Bladder cancer specifically is the multiplication of cells called the urothelial cells. Next question to ask, what are the symptoms that I'm looking for? Symptoms can come and go, but they mostly include blood in the urine. This should always make you nervous. Pain on both sides of the back or above the pubic area, and problems with urinating. These include pain when you're urinating a lot often, or leaking urine. These symptoms can be confusing as they could be caused by other conditions, not just bladder cancer. But if you have any of these symptoms, you may need to talk to us. Is there a test for bladder cancer? Yes. Doctors can do a lot of different tests to check for bladder cancer. The first and foremost test is checking the urine. The urine cytology, we call it, it could be done at any of the labs. This shows what types of cells are present. Not one of the best tests, but does give an indication. As always, the next test is imaging. We do imaging studies, including taking pictures that create pictures inside the body of the bladder, including a CT scan, an MRI scan. And then this lets us look at the entire urinary tract, which can show tumors or other abnormal growths. Cancers that are arising within the bladder often are a manifestation of the urinary system cancer growing into the bladder or away from the bladder in the ureters or in the renal pelvis sometimes. Another important test is cystoscopy. This is a procedure in which the doctor looks directly inside the bladder and the urethra. It's a tube that transports urine outside the body, the urethra. To do this, we call a tool called a cystoscope. This is a thin, flexible tube with a camera on the end. The camera sends pictures to a screen. The cystoscope is gently guided through the urethra into the bladder. The doctor may also ask to take a sample of tissue called a biopsy and to study it under the microscope to what it actually shows. So please know your symptoms, know your body. Come, let us help you. If you have any of these symptoms, we'll guide you in the best possible direction. We wish you the best. Always remember, cancer is a chronic disease which can be often treated for long periods of time. Awareness is key. Thank you. Stay safe and stay healthy.